good afternoon. Myself, Dr. Kausik Bhar, presently attached as Assistant Professor of Medicine in the Department of General Medicine in SSKM Hospital. Uh, Today, I'm going to discuss about the hypertension, understanding the hypertension. This discussion will be on the high blood pressure, which is known as hypertension, is how to prevent it. Generally, everyone would like to have a healthy and normal blood pressure. But what exactly does it mean? Basically, each time when the heart beats, it pumps the blood into the blood vessels, and this creates a lateral pressure in the walls of the vessels, and this is known as blood pressure. Normally, in healthy person, it rises and falls throughout the day, but when the blood pressure remains very high for a longer period of time and it left untreated, it can lead to serious health problem. In general, persistent increase in high blood pressure higher than the normal blood pressure. This is known as hypertension commonly. So high blood pressure or hypertension usually develops over time. It can happen because of unhealthy lifestyle of choices. For example, not having enough regular physical activity, obesity, that is a very high body weight, addiction like smoking, tobacco smoking, excess consumption of alcohol, excess consumption of fatty foods, fried foods, uh, fatty diets, and mental and physical stress excessively. There are other risk factors that can also increases the risk of developing hypertension, such as age. This is a non-modifiable risk factor. As people get older, the arteries stiffen up and narrow as excess fat builds up into the arteries, and that will lead to hypertension in elderly individual. The family history of high blood pressure, one or more of close family members, particularly in blood relation with hypertension, if you have, it increases the risk of having hypertension in lifetime. Excess intake of salt is also known to raise the blood pressure. This is a very important risk factor of hypertension. Not eating enough food with potassium salt that can increases blood pressure and the risk of stroke and chronic kidney disease. Eating a processed food, fatty food that increases the fat throughout the body and make the heart work harder to push blood through the body, hence causing blood pressure to rise. On the other hand, lack of physical activity is also linked to obesity and further high blood pressure. Another one is stress. Reacting to stress is unhealthy ways or not managing stress can also increases the blood pressure. So moving on, hypertension does not have any obvious sign and symptoms. That is why it is often called as silent killer. It puts people at risk for several diseases from cardiovascular problem to kidney problem like stroke, heart attack, peripheral vascular disease, chronic kidney disease. It may cause eye problem like hypertensive retinopathy leading to blindness. Hence, early and accurate diagnosis is very important in the management of hypertension. Measuring the blood pressure is the only way to know whether a person is having high blood pressure or not. So, measuring the blood pressure is the only way for detection of hypertension. Generally, when symptoms do occur, they include headache, neck pain, tiredness, visual changes, buzzing in the ears, fatigue, nausea, vomiting, etc. A person is experiencing some of these symptoms, then one should get their blood pressure to be checked. Fortunately, high blood pressure can be easily diagnosed because the measurement method is very easy and it can be treated also with common medication. So it is usually measured with an instrument which is known as sphygmomanometer. A blood pressure is recorded in two numbers. One is systolic, another is diastolic. Now let's try and understand what do these numbers actually mean. A healthy or normal blood pressure should be lower than 120 upon 80 millimeter of mercury, or it can also read as 120 over 80 millimeter of mercury. Here, the upper number indicates systolic blood pressure, which means pressure in the blood vessels when the heart contracts, whereas the lower number indicates the diastolic blood pressure, means the pressure in the blood vessels when the heart rests between the beats. If blood pressure level is more than 140 upon 90 millimeter of mercury, then the person have hypertension. And if the person have BP levels higher than this, then he or she might at risk of developing serious diseases like heart disease, stroke, heart attack, kidney disease, peripheral vascular disease, etc. On the May 17th, we celebrate the World Hypertension Day, a day dedicated to highlighting the importance of monitoring blood pressure and bringing the global awareness to the 1 billion people living with high blood pressure worldwide. The theme of this year's World Hypertension Day is measure your blood pressure, control it, and live longer. Ensure that your BP is measured and controlled if it is elevated. The risk can be prevented and reduced by taking steps towards a healthier lifestyle, such as regular exercise, healthy diet, quit smoking and alcohol intake, regular blood pressure monitoring, management of stress, and adherence to the antihypertensive medication. If blood pressure is successfully controlled with such lifestyle modification, and then it might avoid, delay, or reduce the need for medication. This is very important. So let's take look at these strategies one by one. The first is exercise and physical activity. Exercise can be a drug-free approach to lowering the high blood pressure. Regular physical activity makes person's heart stronger. If one have a stronger and healthy heart, it can pump more blood with less effort. So, if heart has to work less to pump, the force on the blood vessels will decrease and lower the blood pressure. In other case, as we all are aware that age and weight gain are the two major risk factors for high BP. So, if the blood pressure is at a desirable level, that is less than 120 upon 80, then exercise can help to prevent it from rising as your age. So regular exercise also helps to maintain a healthy weight, which in my opinion is an important way to control blood pressure. One should aim for at least 30 minutes of aerobic activity most of the days of the week, particularly at least 5 days a week. The high BP level can be reduced by doing regular structured exercise as brisk walking, jogging, swimming, etc. Now come to the diet, the healthy diet. The diet also plays an important role in controlling blood pressure. A diet with a high intake of vegetables, fruits, and whole grains is recommended for hypertensive patients for lowering blood pressure or preventing hypertension through dietary intervention. One can adopt a dietary pattern such as DASH diet or a Mediterranean diet, eating less saturated fat and total fat, getting plenty of potassium containing food, And the DASH diet, DASH stands for Dietary Approach to Stop Hypertension. Eating a DASH diet is rich in whole grain, fruits, vegetables, and low-fat dairy products, and skim of saturated fat and cholesterol that can lower one's blood pressure by up to 11 millimeter of mercury if having high blood pressure. Reduce sodium in your diet. A small reduction in sodium in the diet can improve the heart health and reduce the blood pressure by about 5 to 6 millimeter of mercury if you have high blood pressure. So to decrease the sodium in your diet, you can consider tips like read food levels if possible. Choose low sodium alternative of foods and beverage you normally buy. Eat fewer processed foods. Only a small amount of sodium occurs naturally in the foods. Most sodium is added during processing, so you can eat the natural products. Do not add salt. Just one level teaspoon of salt has 2300 milligram of sodium. So avoid adding salt to your food. Use herbs or spices to add flavor to your food. Number three is a quit smoking. The smoking is injurious to health, and stop smoking that helps your blood pressure return to normal within 6 months. So quitting smoking can effectively reduce your risk of heart disease and improve your overall health. Now, regular blood pressure monitoring. This is very important. So some of the hypertensive patients check their blood pressure by visiting doctors, but it is not always possible for patients to visit doctors and check up their blood pressure. Hence, most often I advise the patients self-monitoring of their BP levels. So self-monitoring helps person to measure BP at different times throughout the day and over a longer period of time. It also assists the doctor to get a more complete picture of a person's blood pressure reading at different times. Further helps us in better prediction of the cardiovascular morbidity and mortality rather than single routine blood pressure monitoring that occurs during clinical visit. Now come to the stress management. By learning how to relax and manage stress can improve the emotional and physical health, and it lowers the high blood pressure. So stress management technique that includes exercising. Definitely, if you do exercise for a certain period of time, it releases endorphin in your blood and that relaxes your mind and that also reduce or control your blood pressure. Listening to soothing music that also improves your blood pressure control. It is a proven fact. Focusing on something calm or peaceful like meditation. This is very important lifestyle modification part. If you meditate daily, your health becoming very good, and blood pressure control, diabetes control will be definitely better along with medication. Now, adherence to medication, this is the last point. This is very important point. So, a medicine to lower the blood pressure that is recommended by the doctor. And if your blood pressure is consistently high, usually at or above 140 over 90 millimeter of mercury, adherence to medication is very important as it controls your blood pressure regularly. Usually, we see the patients coming to our clinic with a high blood pressure, and we start medication for them, and they usually take those medications for 1 month, 2 months, or 3 months. And when the blood pressure becomes under control, then they stop the medication. And this stopping medication is very detrimental for the patients because it causes rebound hypertension. Say, for example, a patient comes to us with a blood pressure of 140 over 90, and we start antihypertensive medication. After taking medication for 3 months, he or she stopped the medication. Then, when his blood pressure is getting up, and that will be higher than the initial presentation. When he stops all the drugs and comes to me after 6 or 12 months, then his or her blood pressure becomes 160 by 100. This is known as rebound hypertension. So whenever you are put on antihypertensive drug, you have to continue your antihypertensive drug as instructed unless or until you are having hypotension. The hypotension means the systolic blood pressure is less than 100 and diastolic blood pressure is less than 50. Unless and until this reading comes down that low, never stop medicine, because sometimes the person having 140 up 90 blood pressure after taking medication, the BP reading shows 110 by 70. He or she thinks that the blood pressure is very low, so I have to stop the medicine. This notion is absolutely abnormal and the wrong notion. Never ever stop antihypertensive medication without instruction of your doctor, or if you have symptoms of hypotension like dizziness, blackout, vertigo, uneasiness, then you check your BP, and if your blood pressure systolic is less than 100 and diastolic is less than 50, then you may stop your antihypertensive medication. At last, I would like to suggest that there is nothing more precious than having a fit and healthy life. So adopting healthy lifestyle can help us to enjoy long and healthy life. High blood pressure can be prevented as well as controlled in many ways. Keeping blood pressure in the normal range is very important in preventing cardiovascular complications. It is very much possible to maintain the normal blood pressure level with regular monitoring and preventive care. So, if you control your blood pressure with medication, you can prevent several life threatening diseases like stroke, like heart attack, like chronic kidney disease, like peripheral arterial disease. So, I just reiterate the slogan of this World Hypertension Day as measure your blood pressure, control it, and live longer. Thank you very much.